So one of the biggest things that a lot of people talk about in the teaching world of nursing is that actually making drug cards, having people write out drug cards is very old school. And yes, you can buy drug cards out there. They're out there. You can, download an app, do all that stuff. But I will tell you, I have found that if you write your own drug cards, if you start to get those handwritten out and do them yourselves, you are so much more on top of the medications. It makes it easier for you when you go to take tests and you're learning about certain specific disease processes. So this is a very short, quick little video on how to make a drug card. So let's get started. So this is actually just a template. It's out here for my students. Just freeze it. You can use this. You can actually download it. It's one of your resources, but it does hit everything that you need. It's kind of nice, but it's a full page. So I did decide to show you some other ways or other kind of examples of how to make drug cards. So you can get small little cards, index cards. You can get big index cards. You can get index cards that have big brown binder things in it, so you can just flip through. You can do them on paper, spiral notebooks. It is up to you, but do what is best for you in your learning process so that you will benefit from this actual assignment. This one right here, if you're looking, is great. Generic name of the drug, the trade name of the drug, classification, it tells you that, action, effect, action and the effect, the route, the dose, side effects, and the nursing implications or nursing things that you need to know. And for this one, they said, obtain a history of usage of penicillins and cephalosporins, because you're giving something that if they've had it before, you would like to know if they've had any allergic reaction, or if they had an allergic reaction and shouldn't be taking this medication. So it's really good to take a look. Here is another great. You can see they have the little metal rings. You can buy those out in the store. They've got the drug, then in actual red it says it's cardiac glycoside and inotrope. It's a digoxin is the thing, the brand name, that's the generic name. The brand name is Lenoxin. Then how it comes, it's letting you know how you can give it. If you're giving it, in pill form, or you giving it in IV form, this is how it actually comes to you. Side effects, they've got them written out, the ones that they really need to remember. When you're making drug cards, I'm going to say this, you'll come across side effects and you might have 25. What you need to do is go through and pinpoint. I will honestly say nausea and vomiting, the NV there, is probably on every drug that you give. It's always a given. People have nausea and vomiting, or can if they're taking the medication. So do you need to write that every time? No, I'd leave it off and or put a little NV somewhere so you know. It doesn't take a lot of room. But the point is pick the ones you don't know, ones that you need to know, and move forward. Here is they're doing their peak, duration, half-life, and they have it written across, which is a good reference if this is a drug that you need to know. So really quickly, the things that you need to know to make a good drug card, you need the name of the drug. The generic name is there's only one. It is the one that is given. It's kind of there's a chemical name to the drug. It's like if you had 2 hydrogens and this and this and this, or it'll have an actual chemical type name. Then you have the generic name, and that is the name. So like for Tylenol, it's acetaminophen. And then you have the brand name. So different companies will make acetaminophen and produce it, put it out into the stores, and that's why we get Tylenol. So you need to always have the generic name. And note to self, the NCLEX will only have generic names on the boards. So you really need to learn the generic names of drugs. And I will honestly say, because I'm an old school nurse and been around for a long time, some of that's hard for me because I just learned, forever Lasix was Lasix, but now it's furosemide because that's the generic name and other people are making furosemide. So there's just things that you need to know. The class, the pharmacological action, that's what the class is. It's the desired action of the medicine. So if I'm giving acetaminophen, it's an antipyretic. Now, we take it for aches and pains, you take it for this, that, and the other, but it's truly labeled as an antipyretic. It's going to lower a fever. This is what we give to bring temperatures down. Mechanism of action is how does the drug work in the body? So what does it do? You take it, and what is it going to do? Well, it might draw this or do that or whatever, and that's what mechanism of action is. Indication is the therapeutic effect of the drug. It's going to lower the fever. It's going to do this or that. Side effects. Side effects are suspected effects of the medicine. That's where you get nausea and vomiting. We expect that to happen if you take this. So guess what? We're going to go ahead and give you an antiemetic. We're going to give you an anti-nausea medication so we can actually prevent you from getting sick. And I would always, and I made this note for you, add any labs, information needed, and it won't let me move my little camera, but major warning signs, any major signs that you should be warned about. Those need to be added to your cards. You can change color, as you saw how they did things in red. It doesn't matter. They're for you, and you need to get the information on there and utilize these because they're going to really help you as you go along. I promise. So a few definitions just to kind of help. Therapeutic effect is the expected response for the medication. So if I give you Tylenol because you have a fever, my hope that is your fever will come down and you will feel better. If I'm giving a pain medicine, my therapeutic effect hopefully will be that you have no pain anymore. That's what we're hoping for, right? Or at least to bring the pain level down. Side effect, just so you know, is the expected effect. So example, nausea and vomiting. I use that one because we see it almost on every med. We expect that to happen. Now, is it going to happen? Not always. But the majority of people out there and the research that's been done is these are the things we see. So you kind of know. If you're going to take an ACE inhibitor, you're going to have a little dry cough, most everybody. Not 100%, but 98%. So you need to make sure you understand that. So that's a side effect. Adverse effect is, and there's a difference between side effect and adverse effect, and you need to understand that. An adverse effect is not a side effect, I put that in there. It is an unexpected outcome. And I didn't type outcome there, you can just pencil that in, but it's an unexpected outcome. So what happens is you're not supposed to be vomiting, but you are. It was not expected. It's something, and that's an adverse effect. So there is a difference between the two. If we expect it, it's known. If we don't, and all of a sudden something happens, it's an adverse effect. And so most likely we'll either you'll call the physician, let him know, and he'll probably take your patient or client off of that medication, or he'll add a medicine to help along with it, and making note of what's going on with the patient taking this medicine. And then we have toxic effect, and it's as simple as, the toxic effect is as simple as it sounds. It's an accumulation of medication in the blood. So for whatever reason, we are piling up this medicine. So one of the things, like if you have an elderly client and you give them pain medication, because they have decreased nephrons in their renal system and their kidneys, because things are affected, everything is slowed down with the elderly, they hold on to things. So if I give morphine, let's say, to an elderly patient and they're still having pain, and I go ahead and give them more morphine, well, what's going to happen is they're going to get so much morphine, they're going to get relief, but there's so much and they're not going to excrete it like they should, and so they can become toxic. They can have issues with respiratory status and stuff like that. So the toxic effect is as simple as that, accumulation of medication in the blood. It can be for those reasons, like I just mentioned, aging in that, or it can be that they've overdosed. You decide to take 6 of something when you were only supposed to take 1. And we do see that a lot, especially with home medications, just depending. And then that plays into that aging process once again. Did they forget to take it? Did they forget that they did take it and they take more? Just things like that. So those are some actual definitions that you need to understand. So this slide here is definitely for my students right now, but for anybody out there, if you want to get ahead of the game and you're doing drug cards, 20 medications that are the most given meds, they're out there. I kind of compiled them I pulled them from here and there. But let's make drug cards. So we are going to divide this up for my students and actually assign week to week how many to make and how to make them, and to upload them as an assignment. But the hopes is by the time we get into the clinical setting that we'll have these 20 cards already made and then any extra cards. But these are medicines we give a lot, we see a lot, so they're great. And they're across a broad look at medicines. I mean, I put ibuprofen and Tylenol because we do give it. We give it in the hospitals. Coumadin or warfarin, it's there. So these are great meds to look up and learn because you will see them. They will be in your clinical setting. They'll be on the boards. You'll be tested on those when you're doing units of the disease processes that use these drugs. So this is a good start or a kickoff to just do drug cards. So, and for all my students out there, next week you will be assigned. So don't fret. You don't need to make a drug card this week at all. This video is just to show you, give you the list. And then next week there will be an actual assignment. And this is just so you know, if I do have Facebook for Professor Kristen, and I've also got a YouTube channel where all my videos are there. Thank you.